It was the work of a couple different huge mentors in my life. One was an unknowing mentor in that I was working at a facility in neurotrauma and witnessed a lot of patients who were devastated with injuries. And because of the work of some of the interstomal therapy nurses, the CWOCN nurses, and watching their practice, it really opened my eyes to the fact that there is something else going on in nursing specifically, but also just in the whole idea of patient care. And from there, traveling back to meeting some of the mentors at VCU and ultimately being educated at the Cleveland Clinic R.B. Turnbull School of Interstomal Therapy is really where I really started to get involved. Well, the reason why I keep coming back is I think the first time I was ever exposed to SAWC, it was frightening. And it was frightening in a sense of practice. It was frightening in a sense of how much was out there. How much was out there that I did not know. How much that was out there that I realized my facility or the other care partners, caretakers in our area did not know. And just also the general medical community was not aware of. And that really intrigued me, excited me, and it brought me back the next year to just try to get as much information and knowledge on multiple different aspects. The thing about SAWC is whether you're a physician, you're a wound ostomy nurse like myself, you're a PT, you're a registered dietitian, there are so many different things out there that allow you to enhance your practice, whether it's going to a very highly specialized meeting from somebody in bench research to looking at a best practice scenario with nursing, or whether it's getting involved with a lot of our great organizations, just even getting involved with volunteer work and having the opportunity and the benefits of an organization like the AAWC and the great bench work done by Wound Healing Society is just, it's unsurpassed, it's unparalleled out there right now. So what I would say is that if you're out there and you're not sure whether this meeting is for you, you have to understand that you will never have the same practice ever again once you come here, and it will drive the need and frustrate you in a sense of you need to go back and try to get everyone in your facility to be involved with this meeting, especially if they're surgeons, especially if they're physicians involved in wound care, involved in infection control, nurses, physical therapists, rehabilitation. There are so many avenues, both inpatient and outpatient, that will redefine your practice. Well, the great thing is with what is provided with registration as far as the access to all of the lectures, the access to CDs, the ability to order or have some of these educational materials provided for you, and not only that, but the quality of the actual lectures with the involvement of NACME, the involvement of HMP Communications, and making sure that what is delivered is evidence-based, what is delivered is very funded in research, or is the new groundbreaking information that you need to understand. By doing so, you can very easily take that information and transfer the knowledge back to those clinicians who maybe aren't practicing up to the level that they need to be. And because that information is so well constructed and so well referenced, it's easy for you to just kind of be the mediator and say, you need to take a look at this. You need to review this information. Trust me, it's not just me saying this. Look at all the experts that are here. And then the next thing you need to do is get your application for the next SAWC and start joining some of our professional organizations in order to get more information.